good. All right, thank you for that reminder. We have vouchers in front of us. Jen, is there anything you'd like to highlight?
Just over 100,000 in vouchers for the month of July. Lots of our medical director services. We did make an additional payment to the Southwestern Michigan Planning Commission for the 4x4 grant for the nature trails. And we did have a couple of marijuana dirt on weed campaigns that went out to the media.
All right. Okay, you have the vouchers in front of us. May I have a motion for approval?
So moved.
Okay, and a support?
Support.
Okay, Dr. McBride moved, Joe supported. Any discussion? All those in favor?
Aye.
Opposed? Motion carried. All right. So we have a number of resolutions in front of us. If it's the pleasure of the board, I'd like to take them all together. So Courtney, if you would like to lead us, or one of the staff people lead us through.
Sure, absolutely. So the first agreement is just a renewal agreement in our partnership with the Sickle Cell Disease Association of America. That is something we've had for a long time, so just bringing that forward for the upcoming year to you all. The one after that is actually a request to apply for funding. We have been United Way funded partners for a number of years. In the time of COVID, they took their normal 3-year grant period and they extended, and everyone got an extra year. So we would have normally applied last year. They gave everyone a 1-year extension, but the impact agenda for change has been released. A letter of intent is due here at the end of September, so we are working internally for what those exact requests will be, what that amount will be. We'll bring that back to the board. The full application will then be actually due in December, so we will talk about this more this fall. So this is just our initial step, asking you all for our ability to continue to apply for the United Way funding, to be that funding partner. Again, we're still identifying exactly that amount we'll ask for and the intricacies of that, but it will be for family health programs. So Nurse Family Partnership, MIAP, Triple P, the programs that have really worked with United Way successfully in the past as well.
All right.
And then the third one I'm going to have Jillian share about.
The third one is a request to receive a little bit additional money for the Double Up Food Box program that goes for the Benton Harbor Farmers Market. This is through Fair Food Network. We've had the Double Up Food Box program for, probably 8 or 9 years now, and it allows SNAP or EBT users to purchase fresh fruits and vegetables at the market and actually have those SNAP dollars doubled. So this year, we have had a just booming year of the farmers market.
Great.
Our average attendance has been well over 300 each week.
Wow.
And by about midway through the season, we thought, hey, our Double Up Food Box money is going pretty quick, meaning people are really using that benefit. Additionally, during COVID-19, that program did allow for the money that is allowed to be doubled from $20 limit up to a $50 limit.
Great.
So people are using it, they're buying more fruits and vegetables. So Fair Food Network has said, we have more money if you need more money to make that program run. So we're now just requesting an additional $500 at this time to get us through the rest of the season. Market is today, if anybody wants to stop by. On their way out of here, starts at 10, and we have 3 more weeks.
Wow.
When does the season end?
September 15th.
Oh,
so including today, 3 more weeks.
All right.
Motion to approve.
Okay.
Or are we gonna take these all together?
Second.
Okay, so motion to approve, second. Any discussion other than hurrah?
Hurrah, no. How do we advertise the farmer's market?
We're doing quite a bit with Facebook,
Okay.
and just some of our community partners have been really phenomenal in stepping up to spread the word about the market. Be Healthy Berrien, which is an initiative run out of the United Way, Southwest Michigan, has been a great partner in spreading the word as well. And then honestly, we do a lot of old-fashioned kind of flyering of the community. Just making sure that, especially in that downtown area, that we've got posters up. You'll note them here in our building as well, so people are aware that that market is happening. And then just word of mouth is a really powerful vehicle for letting people know as well.
Do you have, at the farmer's market, do they have any classes on food preparation?
We have not this year. In the past, we've partnered with Spectrum Health Lakeland, and their Center for Better Health has done a program called Prescriptions for Health, which benefits folks that live in Harbor Towers, the apartment complex that's right there near downtown. And in that program, they have done just different cooking demonstrations, food preparation, learning new ways to use fruits and vegetables that are available at the market. Last year and this year, we have not done that program. We're hoping that we will be out of COVID-19 by next summer, and we'll be able to bring that back more full force.
How many farmers do you have of people selling?
This year, we had more farmers than we've had in a really long time. I want to say probably about 15 different farmers, and then some additional vendors. We've had more community partners that are down there as well. Curing Circle, Area Agency on Aging, the YMCA of Greater Michiana has been down there with a Zumba class. The Benton Harbor Library is down there for story hour for the kids.
Oh, great.
So it's just been a really wonderful community partnership.
All right, not seeing any additional discussion. We've had a motion and approval. All those in favor?
Aye.
Opposed? Motion carried. Jennifer, the financials?
Sure, so we forwarded the financials earlier, and you can see them in the packet. We're gonna keep it a little bit brief this month. We are favorable in our grant revenue, about $1.2 million to budget, and we are favorable in our expenses, $400,000. So net to budget, we're $1.6 million favorable for the month. Do you have any questions with what you had in the information from last week?
And one thing to note for the board, we are working on our budget for the upcoming year. So our plan for you all is to be able to send that in advance for your review before our September board prep. Can't believe it's September. Our September board prep, and so that at that board prep meeting, we can go into that a little bit more deeply with everybody. So that's where a lot of our time is being focused right now.
I bet. Thank you. It's not for the faint of heart, is it? Okay. All right, very good. Moving on to the administrative updates.
Yeah, so before I jump into COVID-19, we will in upcoming months, we'd like to start bringing back some of our programs to share what's been happening. Rightfully so, we've been very focused on COVID-19 and some of our increases there. But Jillian sharing about the farmer's market in October, we'd like to come back and be able to share about just beaches for the summer, vector-borne surveillance, farmer's market, some work with 4x4. So know that all of that work is ongoing, and we will certainly come back as that has as our season shifts and be able to share a lot more of how that went this year. As we mentioned, we are working quite heavily on our fiscal year 22 budget. So we will have more to discuss at board prep with that, but are really working on that. We've received COVID dollars again, which is really good. That's certainly a blessing in our budget, but also just a complication of adding that in with all of our normal funding. So we are working through all of those features. And then one of our focuses right now from an admin team is really just positions and staffing level. We have had some attrition and some changes over the summer. Some of those have been filled by staff who were originally hired to serve in COVID-19 roles. Each time one of those roles has been vacated, have really been assessing, is it time to rehire? Do we not? We do have funding for the upcoming year, and we do have that need of hands to be a part of the team and help with that work. So we are hiring for a handful of positions right now. Some of those are COVID, some are not. We've had some other areas of the department as well. So we will have a more thorough update of that in September too. But if you have areas to promote department employment, that is one area right now we are certainly seeking some really good team members to join us.
I would, actually, I'd like it to, in the next couple of months, to see an organizational chart or
Sure.
put it online, who's who, and, now that we've had sort of a turnover.
Yeah,
Good idea.
absolutely. We do have an organizational chart online that I can send just so you have now, but I'm sure some of those are vacant. So what we can also do is show where we're hiring and where we're trying to kind of mold those together. Absolutely. And there've been a few changes with positions even in our CCHS area. Great. Okay. Well then, with that, I'm going to jump into where we're at with COVID-19 and some of our data. Board members, you do all have a packet of these printed slides too, if that's easier to look at than trying to get to the screen. We tried to orient this week so everyone can see what we are sharing. So first, no, it might not work. I might have to go up there. That's okay. Oh, here we go. Okay, cool. So I'm not going to go over this slide again, but just a reminder, these are all of the different data points that we're looking across and monitoring. So diving right into our cases and our transmission, we are looking, of course, at our 7-day rolling average. This is over the whole course. Again, we can continue to see that increase here as we are in late August into September. Right now, those numbers put our 7-day rolling average at 36.7 per 100,000. What that looks like a week ago, we look at this every week, so Friday ending last week, that's about 35 cases a day coming in. So that is starting to really strain our case investigation and contact tracing. That has definitely accelerated and started to make that work quite heavy for our team to wade through. So we are working to do some prioritization there, make sure that we are still doing really meaningful follow-up to cut that chain of transmission. Julian, this is working.
It is.
Yeah.
You're double clicking.
Okay.
I'll stop helping.
So this slide is a combination of two things. This shows our 7-day percent positivity. That is the orange line, as well as our 7-day cumulative average of cases, and that is the blue bar that you see. So again, I mean, this is not much different than when we talked about this a week and a half ago. Our percent positivity has continued to increase, as has our cumulative case rate. We are seeing that continue to grow like we are seeing across our region and state at this time. So then if we look at this a little bit different, just to look at some of those same things, this top graph is showing you our new confirmed and probable cases. So just to remember that 7-day cumulative weekly case rate is a rate. So the cases that go into that are that top part, and then the two bottom bar graphs are essentially that 7-day cumulative that we just looked at before, and then percent positivity, just a different way to look at that. A couple of noteworthy things as we look at this here. So from August 1st to August 30th, we had 790 confirmed and probable cases. That is a 4-fold increase from July of this year. In July, we had 156 cases. So again, those impacts of Delta, that higher transmissibility, we are certainly not being exempt from that here. We are seeing that 4-fold increase. If you look year over year, August 2021, with that 790 confirmed and probable cases, is a 73% increase from August of last year, which we had 330 cases at that time. So just some reference points as we think about these numbers and look at that impact right now. Looking at our hospitalizations, we continue to monitor this with Spectrum Health Lakeland. As we talked about at our last meeting, there are definitely other impacts on our health system at this time, other respiratory things that they are addressing, as well as just general health care that we really need them to be successful in serving in our community. Like us in searching for staff, our hospital also has a different staffing level than they did a year ago. But we have continued, unfortunately, to see some of those hospitalizations rise, as well as now you can see A few weeks ago, we were saying no ICUs to our hospitalizations. We are now seeing in the 3 and 4 consistently for ICU admits. When we also look at this, we're able to look on some regional aspects, the state site, this is publicly accessible data. But if you look at our hospitalizations, they track actual capacity of hospital by beds. In our area across our 3 hospitals, we are right now consistently over 70% capacity. So these are things that are definitely concerning because we just know that fall is a higher respiratory time in general, and we have those now competing priorities for our hospital time. We know that there's already that staff burnout and that that hospital inundation is where we really want to focus on ensuring we don't get there. Other things with that is right now across the region, so region 5 and 6, so basically the Southwest Michigan area, Grand Rapids, Kalamazoo and down, we do have roughly 6 pediatric hospitalizations at this time. Vaccine numbers, just been updated, graph for us of where we're seeing those vaccine numbers increase. We are starting to see more green. This is successful. We're really happy about that. Our 12 to 19, that 35%, and then 12 and over, so all is 56%. And of course, we know our 65 plus, we're in a really good place and have that higher coverage yet. We are certainly starting to see a lot of people come in for that additional dose.
Good.
For the immunocompromised. We're starting to get a lot of calls and requests for the booster.
Yes.
But we are not doing that early. We are gonna wait for CDC and FDA to say go on that, but we are making those active plans on what that looks like this fall. Trying to work with our senior centers to make sure that we are back accessible in our community. The purpose of doing that the first time around was so that folks had an option close to home where they were familiar and comfortable with. We're gonna do that again. Fingers crossed, we'll also pick up some first timers because we know while the booster is really important, we actually just need more of our unvaccinated to get that first dose and start that trajectory.
Are we offering the booster to immunocompromised patients? We are offering.
We're doing it's called the additional dose. And that's the one that 28 days after, we are doing that right now.
But you're doing that here?
Yes.
Just with a prescription, or how does that work?
If someone calls, we are encouraging that everyone talk to their primary care physician or whoever that appropriate physician would be. We want them to have that, and then we ask them they come in, if they've done that and they have one of the conditions that fits the CDC, we will do that vaccination. Yeah. We are encouraging, I mean, we're not the only place you can get a vaccine in the community, so we are still trying to encourage, like there are pharmacies, there are walk-in clinics to use all of those options. All right, so talk a little bit here about why this really matters. So why we're really focused here today and some of our goals that we've had this whole time, of course, the overall emotional, mental, and physical health of our community. One huge aspect of that is our schools and our impact to staff and students. This is just showing last year the isolation and quarantine impact to schools. So we had over 12,000 instances of isolation and quarantine. So when we think of our goal of keeping kids in school, in-person learning, that classroom-based curriculum, this certainly is not what we want to repeat. This is not what we want to see again. We know that in-school connections, those social connections, those educational connections you have there are so incredibly important to our community, to our youth. So that's really what is driving a driving goal of our work right now. And so we don't want to see this repeated. What we can say over, unfortunately, the last couple of days of school, we already have 43 staff and student quarantines in 2 days of school, and those are school connected exposures. And we will this week be reporting our first school outbreak. So we are getting increasingly concerned that goal of keeping students in school is not going to be met with our current trajectory. We just are having that increased pace. We have had a different layering of preventative measures this year than we did in the past year. So this 12,000 was last year, with some of our time actually ending up having to be remote. We have less kids who are doing virtual this year because they are in the classroom, so we have higher classroom counts. We also just have less of those protective measures, right? We did tons of cohorting, we did lunch in classrooms, we had masks, we had all of these different layers last year. This year, we have relaxed some of those, and rightfully so. We want as much normal as we can in our day. We want those social connections. But we are seeing from a public health standpoint, it is time to layer back on some of those preventative measures. One of those key measures we know we can layer on is face masks, and that universal face mask. Again, that is really protecting everyone when that mask is in place. What that allows us to do is not disrupt other normal learning instances that are happening. It allows us to keep kids in schools, it will lower transmission, and it will result in less quarantine. If we have universal masking in place, we can administer a 3-foot close contact definition for our schools with our students. That is a lot less students being knocked out, even just looking at our tracking logs in the first 2 days. One case is taking out a classroom at this point, and that's just not where we want our community to be. Certainly concerned, especially looking at schools who have now gone in longer than us. They have high numbers out and are now already looking at maybe it's time to go virtual, and that's not our goal. Yeah.
Question was asked, I think at our last meeting, how many quarantine students actually ended up with COVID? Had the data, I don't even know if it's available. Do you
Yeah, that's a hard number to get because we don't have not everyone is tested when they're in quarantine. So we know that sometimes they might be in our probable case count or our projected date. If someone is symptomatic, it's up to that family if they want to be tested. So we don't actually have a test of everyone who is in quarantine to know if they were a case or not. So unfortunately, that is really hard data. I mean, we can make some assumptions, but they're not, there's a lot of faults with those assumptions, unfortunately.
All right, did you have a question?
Yes, I do. Courtney, how many of these, two-part question, how many of these 12,000 were repeats? Quarantine more than one time, do you have any idea on that?
I don't know, but this is definitely not unduplicated. So that means kids missed a lot of school if they were quarantined more than once.
Sure.
Yeah.
Roughly, any idea what's the total county population of students and staff?
About 25,000, right, for students.
Reasonable number.
Yeah, and then it's a few thousand, I think it's like 3,000 or 4,000 staff across public and private.
Okay, thank you.
Yeah.
I
All
would
right.
speak to that,
Oh.
actually. Our epidemiologist, Guy Miller, has done some deduplication. We originally started out with number.
So it's Dr. Kabaltica.
Oh, sorry.
Sir.
I know Guy Miller, our epidemiologist, has already tried to deduplicate some of that. We started out with close to 14,000. He did some initial cleaning up, so we're down to 12,000. I really don't think we're gonna get below 10,000, and even between 10 and 12,000, that's significant.
Thank
Yeah,
you.
Yes.
Yeah.
That's exactly.
So then I'm gonna leave us time for discussion. I won't go over these last slides. You have them, and we can make these slides available as well. But just basically identifying where a lot of this data is coming from, including our own website. So data we have is up there on our data dashboard. Then some information about impacts to children, and I'll let Dr. Kabaltica address all of that in our discussion as well. Some just modeling of how we know masks can keep kids in school, can keep us in person and help lower that spread. And then I know this, again, I'm not gonna go over, there have been lots of questions though about our cases and breakthroughs and some of those percents. This was a great graphic table that came out from Michigan Department of Health and Human Services. So I just included in that for your review. At future meetings, we can certainly dig into that more too. Basically what this is bringing us to is we are still seeing an increasing need to have another layer of universal protection in our schools. Dr. Kabaltica and I and our team have really discussed it is time to move forward with universal masking for our schools. We have had a few schools who have been able to make that decision of their own accord, but now 2 days in, we are quarantining kids at a rate that is very similar to communities around us that now have too many staff and students out to operate, and that's just not where we want to be. We also know that we're just seeing more hospitalizations, and the more cases we have, just in general, you will get to more of that vulnerable Our school communities are a very complex ecosystem. There is a diversity of staff and students there. This is an action that really can protect the most vulnerable as well as the general population of the school. We know we have students with underlying health conditions. We know we have staff who are in that same boat. When everyone is masked, we keep that transmission lower, we keep our students and staff healthier, and we keep them in school because we are quarantining a whole lot less students. So we are making the recommendation and would like to move forward with a public health action, public health order to support our schools in universal masking. We have brought before you all today, and definitely want to stop and have some discussion, but would very much appreciate your support in making that public health order and supporting our schools to be successful this fall. Couple notes I do want to say about what we have looked at with where we want to place that public health order is it would be pre-K through 12, so focusing very much on our primary school age children. We know that a half of that group is not even eligible for vaccines, the other half has low rate, and again, we're seeing those high quarantines. And we really are tying that to transmission. Our entire back to learning plan has been based on being measured and being able to do what is right for Berrien. We've had the ability to have that local control, which I think is really impactful. We know our community. We know that when kids are in school, we have less concerns with daycare shortages, food insecurities, all of those things. And so we have tied that to transmission as well there. When our numbers are in substantial or high, which that is where we are at now, it is time for that order. We'd like to move that forward. When, because we will, I won't say if, when our numbers when we can get them under control, get back into that moderate or low. Once we are in there for the first day we can get into moderate, a 21-day period will go into effect. We'll monitor that. As long as we stay in moderate or low for that time and there are no increase in hospitalizations or deaths, we would take that back and move back into recommending for unvaccinated, immunocompromised, and of course at family choice. I think that is a very measured step for our community. I think that aligns with how we have supported our schools for the entire 18 months of the pandemic, as well as the school guidance that we have put out. It's just our cases are high enough, the impact to community and schools is high enough. We need this measured action at this time. So I will stop. I'm sure there are questions. Dr. Colvin, want to add anything? Sorry. Okay.
You answered one, which I think is important, which is the exit strategy, because I think it's important for the parents and all to know, when they
There's an
put
exit
in a mask, because I think we're all well aware and heard a lot about the complications of the mask wearing. So I appreciate that is part of our recommendation. A couple other questions though that I have, and that one is, I think I mentioned it here earlier, it's very inexpensive to have a CO2 monitoring device, a couple $100, and measure every classroom with the kids in the classroom to see what the CO2 level is. And it's clearly, I think the criteria is 800 parts per million. If it's that or below, it's okay, it's acceptable. If it's much higher than that, it's not. You got a sick room, which makes you more susceptible to COVID,
Everything.
flu,
Yeah.
whatever it is. So it would seem prudent for the schools to test each of those rooms. So, and maybe test it and post the results, and do remedial action if appropriate. Some could be as simple as opening a window or putting a fan in the room or something. Maybe long-term, or if they have their bucks, they can improve their ventilation systems. I don't know. And I saw a study from Georgia lowered where they did this, it lowered the COVID rate down 40%. So it seems that that's a simple process that every school should do. I don't know if we have the authority to do that or not, but I think the schools should take it upon themselves to do that, to ensure that if they put the kids, they're wearing a mask, I actually support that because of the variant that's virulent. But this is another thing that's very low cost, and the school should be able to do that, in my judgment. If the kids can wear a mask, why put them in a sick room? It doesn't make sense to me. So
So-
I would like to see that.
Okay, let's stop with that before you go on to the next point. Did you have anything more on that? Maybe get a response on
Yeah.
that?
I think that some of our schools have actually moved in a direction to do some of that on a school base. I can't speak to each individual classroom, but I think that is a really good point. We will make note of that, and I think that our goal, at least initially, is to make sure that we can bring that information forward to schools. Ventilation has been one of the layers of prevention that has been encouraged. Many of our schools did some work over the summer to be able to increase that internal building, internal classroom ventilation, even to the point of just making sure they can open windows, to your point. But we can certainly, as a health department team, pull together the appropriate information and make sure that we're making that a bit of a more explicit and then resource-backed recommendation. As far as what further stuff we can take into that, we can certainly look. I don't know what the cost is of that to schools, but we can certainly look where that is appropriate to support.
It could be next to nothing. But obviously, changing, improving the ventilation system, I think it's more pricey, I understand that. And they could put, if they have one or two sick rooms, I guess, they could put a room air conditioner or something.
Some sort of
Air
Exchange,
filtration.
air exchanger. I know in the hospital, Ken knows, when you wear a spacesuit to do your surgery, and the surgery is what, 8 times an hour, they recirculate the air and you get positive pressure in all rooms to eliminate the potential. So it seems like that's a fairly practical, low cost, very effective.
Thank you for bringing that up.
All right. Dr. Edwards?
So, just to comment on that, I think that, when you look at responses to pandemics in general, boy, we've all learned a lot. But that to me is a great intermediate response. I think that's got to be looked at, no doubt about that. I think, I just want to say that I think one of the things that's been lost in our discussions about masking is, who bears the burden when your kid has to go home and get quarantined? And it's pretty clear that there are 2 groups that have suffered the most with this. Women, who have left the workforce in enormous numbers, and the most economically vulnerable people. There are many people that can work from home and work remotely and do all that. You can't do that if you're in sort of lower paying jobs. And, then you add the inaccessibility to meals and the inability to have daycare and watch your children, and the consequences of ignoring the reality of quarantine have detrimental economic consequences to so many families, even if you don't get COVID. And I think, when we look at our response to this, we have to think about the most economically vulnerable people. And women have been just suffered in this pandemic. And it's a great proposal. It's necessary. We gotta keep kids in the classroom.
Dr. McBride?
Well, as I understand, this is part of the Swiss cheese argument in public health. It's one more layer that reduces the viral transmission.
Absolutely.
And I think you're also making the case, and as I look at the scientific literature, that masks do mitigate. Don't reduce to 0, but they mitigate, reduce the odds. My father was in high school in this 1917-18 flu epidemic. He talked about masking. This is nothing new. This is a very ancient public health approach. And in fact, my father talked about some of the same things we hear here about masks. So nothing has changed in 103 years. But you made an important point that keeping kids in school has all those benefits, as Dr. Edwards said. And we get to reduce the social distancing. So actually we improve interactions in terms of spatial distancing. How does this affect outdoor stuff, athletics?
So the public health order that we are bringing forward would be for indoor.
Indoor.
Indoor,
Okay.
not outside. So if you're outside for recess or something else, that's
Right.
fine.
Okay.
Our schools also have lots of layers for if cases were to increase, how to even cohort and do play outside. They know how to keep that area safe, but this is indoor setting.
And so I understand the data is suggesting a trajectory that if we don't reduce transmission, if we don't mitigate transmission, that schools will have to close. Is that the,
That is
that's what you're seeing as a
very stark
trajectory?
reality if our numbers continue to increase,
Okay.
yes.
So the argument is the best way to keep the schools open, for all the benefits Dr. Edwards said, athletics can go forward, outdoor activities can go forward if we mask.
Yes.
Okay. I just want to make sure I understood the argument.
So Ray and then Linda.
This is just impacting schools, nothing to do with indoor activities commercially.
This is for, yeah, this is for educational institutes, so it'd be like pre-K, so, like Head Start, daycare, school type things, but no, this is not private businesses, this is not other gyms or different things, it is school-based, educational institute-based.
It would be for all people coming into the school, be it a parent
Correct.
or bus
Yes,
driver or
teachers,
sporting
students,
event
correct.
indoors, like basketball.
Correct.
Linda?
I think that, and all good points, I think there's something that has also not really been talked much about, and that is the expense if someone is hospitalized.
Yeah.
I mean, and it's, I know somebody who was hospitalized for 6 weeks. Had she gotten it in March, she probably would have died. But there is a huge financial burden
It's true.
for people who are hospitalized that really isn't being brought out. And I think it's another layer of, and to your point, the economic impact of people who have to stay home and take care of a quarantined child, particularly those who are in essential services, retail, supermarkets, is huge and may cost them their job again. So I think we need to keep that well in mind when we talk about the most vulnerable. And the risk of spreading, again, in some of these people with essential jobs, lower wage paying jobs, many of them are in multifamily housing or are in multi-generational families. And so it's not just a child or a child and a parent, it's a child, parent, and extended family. And so that becomes even more exponential.
Something else I think is worth considering is whether or not either schools and or the health department, whatever, would provide the N95 mask to students and that they're sized right. So
Yeah.
adult mask, kid
Right.
mask, so that you know that they have the proper mask. And I think it would help the compliance and the effectiveness, because if you just wear a mask and it's sitting in your backpack for a week, I don't know, and it's hanging on,
No, it's a good
your
point.
nose,
Yeah.
I think, and I guess I was gonna ask the doctor what you thought of that sort of
Well,
process.
forgive me for a second, but I think the school's got quite a lot of money
I heard that.
for COVID-related kinds of things. And I think it's a great idea, but I know some of the schools are already doing that.
I think the discussion of, do you want just the surgical mask? Do you want a multi-layered cotton mask? Do you want an N95 mask? N95 masks really only effective if they're properly sized and worn. We don't have the capacity to fit test every single student. I think there's pretty good evidence that even a surgical mask or a multi-layered cotton mask would be sufficient. Where there's hardship, I think the schools are prepared to at least give a surgical type mask. I don't know that I've got the details on that.
Our schools do have they have stock from last year, as well as we have masks to support them. We will be making sure that we have them. We have child size on surgical masks. We do have some, I think, the KN94s, 90. So there are some different ones there, but we are prepared to also support the schools who don't have enough stock if they need it. To Lynn's point, I do think there has been some funding there that they're able to get some of that, but we're also looking into what else is available. I have our team looking into what other type of child size masks for smaller masks. Our high schoolers can mostly wear what we're all wearing too, but what we can do and then what we can source. So we do have some funding as well that we can purchase appropriate PPE for staff and community. I think it is very in line with that mission to be able to support our schools in that. So yes, Joe, to that point, our team is also looking at, so if we deplete our current stock, we are able to continue to support schools. To our point about having an exit strategy, I hope we're not in substantial and high for forever, right? And we get into that low moderate, but yes, we will support our schools if masking is what they need us to provide that in.
So Ray and then Linda?
Courtney, this is just a thought. Working with big box partners like Myers, for example. You go to Myers and I've been looking to restock my mask supplies. So there seems to be another issue, here we're going to go back again, what we're recommending is gonna be hard to fill.
Amazon has.
I'm sure, you can order them on Amazon, but you wanna go and get it, and I need it tomorrow, because kids are going back to school, whatever. Wednesday, good luck in this.
So we do have a supply at the health department, so as we focus on the kids, I think we're set there, so. Linda, did you have a comment before I call the question?
Just a comment, and that is that I know in our journey with masks in the office, we have discovered that obviously each person is different. Each person has a different comfort level with masks. And sometimes it's a matter of trying, it's like trying on a dress. You've got to try multiples on.
Or a shirt.
Or a shirt, I mean, until you figure out which one may work for you. It took me a while.
Yeah.
Because the adult masks are like wearing, I don't know what on my face, so I now wear a child's mask. So I think that some of those challenges can be alleviated by trying different masks.
So we have thought, we have discussed the mask mandate, and I am at peace with a mask mandate that's tied to the level of COVID in our community. The children whom I love all have some health issues, whether it's asthma or other things. And they wear a mask like a duck to water. So for me, it's something that I think is very important for our community. And I would ask for a motion to approve. Dr. Edwards, a second to the motion? Second. Joe, any discussion of the resolution that you have in front of you? All those in favor?
Aye.
Opposed? Motion carried. So we're moving on to I'm going to pass the resolution on for your signature. We're moving on to the Board of Commissioners. Dr. Harrison.
Okay, 2 items to note for you. First, we're doing a survey for obtaining input from individuals in the county. This will inform the master and strategic planning process. You can find that on the county website, berriencounty.org. I'll also send the link to Courtney. She can pass it out to the commission. And then the others that we're going to be doing a facility assessment. And so, so we're going to be looking at all the buildings owned by the county to see what changes need to be made. We've got some very old facilities and some relatively new. So there'll be some, I think, detailed work being done by some outside contractors. They'll come back in and look here at this facility, as well as the Niles facility, which clearly needs some changes. So that'd be all I have.
And the Three Oaks.
I think we'll see some changes made on where facilities are located and the condition is whether we open, close, build new, or just renovate. So from top to bottom.
Wonderful. All right, you have, we're going to be voting on the slate of officers for October. Just kind of an FYI. I think we've talked about leaving the slate the same, but if you'd like to discuss it, there'll be the board prep in September. If you have ideas or any changes that you'd like to make, we're welcome to see that. So, all right. So as we move into public comment, please know that we're open to your comment, to hearing what you have to say, your opinions, your concerns, your complaints. And we invite you to share them with the board and staff. But please note that during the public comment, we will not tolerate any communication which appears to scare, to frighten, to harass, to molest, to terrify, or abuse the department, staff, or the board members. It will not be tolerated. Residents are entitled to free speech under the First Amendment to the U.S. and Michigan constitutions. We do advise you, however, that not all speech is protected. True threats or like speech are not protected, and those making the comments of this nature are asked to refrain from further sharing and will be asked to leave the meeting should these comments continue. We do appreciate and welcome public attendance and involvement. Each individual is permitted 2 minutes to share. And we ask you, as you come up to share, that you state your first name, your last name, and your address of residence prior to sharing. Thank you very much for coming. We are interested in what you have to say. So there is a microphone right here to come up to, and we welcome your public comments. Welcome.
Where's the microphone? Right here?
Right there.
This thing?
Yeah.
Oh, nice. Awesome. My name's Luke Andresen, resident of Berrien County, St. Joe. Do you need the actual address?
Oh, if you would, please.
2832 Sandra Terrace, St. Joseph, Michigan, 49085.
Thank you.
All right. So the very first thing I wanted to say is how many children have died of COVID in Berrien?
0.
Thank you. 0. That's number one. Number two is what evidence are you guys referencing for the usage of face masks? Because FDA.gov on surgical masks and all of the surrounding materials that I could find, and I've also corroborated this with surgeons, doctors, people in our community, people from outside of our community, all of the information that I've gathered is that surgical masks have always been utilized for fluid transmission between surgeons and patients. That's all they've ever been used for. There are some studies for viral respiratory pathogens as well. But as far as surgical mask goes, every single one of you in this room today that I've observed have worn your mask incorrectly. You've touched it. If you touch it once, it is not effective anymore. And that's a surgical mask. So the cross-fiber weave section of a surgical mask is actually 10 times larger than the 0.5 micron size of this respiratory pathology, which means that a cloth mask is going to be up to 1,000 times bigger. So this is like trying to catch a mosquito with a chain link fence. Does this make any sense to people? And I know you guys can answer me, but asking children, you're medical professional, you are, and you're wearing your mask incorrectly. Asking children to do it is absolute, abject lunacy. They will not, they cannot, it's impossible. They're gonna touch it, they're gonna drop it on the ground, they're gonna pick it up. Even Fauci on the subject, 60 Minutes, did you guys catch that 60 Minutes where he said don't wear masks in the beginning of this thing? In his emails that were leaked, did you guys read the emails where he said he knows that they're not effective? This should be common sense. CO2, gentleman over here referenced CO2 in the classroom. Did you guys know that we have an article? So we've
Okay.
also got a very.
Thank you very much.
Is it just that 2 minutes? Does somebody else want to give me their 2 minutes?
Thank you.
Can I take it 2 minutes here?
No, thank you. No, thank you, sir.
I wouldn't want to listen either. So, Sheriff, would you guys let me get 2 more minutes?
It's not up to us, sir. Have a seat.
Okay, roger that. Here, you want to take my notes? Who wants to do it? Okay. Camera on that one.
Okay, I'm Victory Woodall. I am a resident of Covert, Michigan, but I do business and my children attend school in Berrien County. Let's see what his notes say here. Okay, we talked about that.
Your address?
Your address, ma'am?
41936 70th Street, Covert, Michigan.
Thank you.
I really am not comfortable giving everybody on live my personal address, so I hope you will consider changing that before the next meeting. That's really inappropriate. Okay, so masks lower CO2 content, as he said, in the blood. Pulse oximeter readings are lower when children are wearing masks. It's super inappropriate to mask up our kids, especially, I can tell you from personal experience, I have 3 kids, a middle schooler and 2 high schoolers in St. Joe Public Schools, and they do not tolerate the masks well. My stepson was sent out to the hall, sent to the principal's office multiple times just for taking his mask off to get a good breath this past year. He spent more time in the hallway in the principal's office than he did in class learning. It was probably a 50-50 ratio. It's not good. It's awful for our kids. So yeah, I'm having a hard time reading your notes. But we're not going to stand for this medical tyranny anymore. This should be a parental choice to put our kids in a mask or have them unmasked. If you think we're all so stupid for unmasking our kids, why not let nature take its course if you're so convinced that our kids are going to die and we're all going to contract this virus? Just let all the idiots die, right? I mean, we're not going to stand for it anymore. Our kids aren't going to stand for it anymore. We have a group of over almost 2,000 parents in Berrien County that are fighting this mask mandate. We have lawyered up. We will not stand for it. Thank you.
I'll stand.
Hello, my name is Dana LeDuc. I live at 322 East Colfax Avenue, apartment 207 in South Bend, Indiana. My child is a kindergartner at Buchanan at Ottawa Elementary. And I not only will say, not has only one kid died, there has been multiple children that have died, not just from COVID, but the Delta variant. And 1 children is too many. When my child started school at Ottawa and they had no mask mandate, I was beside myself. I went out and bought a $200 air filter for her classroom and prayed for the best because that's all that I could do. The 3 bugs, they're be respectful, be responsible, and be safe. And my child wasn't even allotted that at her first day. There are 3 children in her classroom out of 15 that wear a mask. On the playground yesterday, 60 kids, 5 masks. That leaves me shaking right here. I understand how cumbersome masks can be. I worked through the pandemic as a healthcare worker. And to be clear, it was environmental services. I was a housekeeping manager. So every day I was printing out 60 different pieces of sheets from the CDC because everything was constantly changing. But that does not mean that just because we made a mistake to keep making those mistakes. Masks are entirely important to preventing this. We have right now, without wearing masks, right now with my daughter sitting in that classroom, being 1 out of 3, we're reversing all of the progress that we have made. And this is a disservice to not only our nurses, our doctors, but the house cleaning staff, everybody out there on the front lines. I urge you, and I appreciate your advice and your expertise. I just urge you that the 21 days.
Thank you. Thank you. Welcome.
Good morning.
Good morning.
Thank you.
My name is Jennifer Alderink. I live in Three Oaks, Michigan. I'm a family physician in LaPorte, Indiana, and I serve on the River Valley School Board. So I came today to give my public comment and ask the board to pass a universal mask order. So I'm very pleased with the decision that you made this morning, and I thank you very much for making that tough call. It's very controversial everywhere, and our county is not alone. I will say our school started on Monday. We had a half day. That very night, a child tested positive for COVID, exposed an entire classroom, had siblings in 2 other buildings. And so I come to reaffirm the practical aspect of this. I think we're getting in the weeds if we argue about the efficacy of masks and the harms. Like you said, we're making this decision when we're in the red, when the rates are the highest. You know, nobody wants to have our kids masked all the time. But now we have more than a handful of kids at our school who are in quarantine, and they're missing the first 2 weeks of school. They're missing learning. One of them is a special ed child. You know, she needs to be there. So just for practical purposes, thank you. We can have this mask order. We can stay in person. Our kids can learn. They can see each other. I can attest when my child was on virtual for 3 weeks, she was the most anxious I had ever seen her in my life. And she's a high-performing student. They need to be with their teacher. They need to be together. And thank you so much for the decision you made this morning. It was a tough one, I know. Thank you.
Thank you. Welcome.
Hi. My name is Ruth Crum, and I'm from Niles, Michigan. And I work for a state agency.
Ms. Crum, would you state your address, please?
I really don't want it to be on YouTube for the whole public.
All right.
I work for a state-funded agency locally that was all about patient choice. They were allowed to make choices that maybe you and I would say, that's really not good. That's not safe. But they were not deemed incompetent, and they were able to make their own choice. Why are you all so afraid of letting parents make their own choices for their children? I also worked for an agency that was very tough, and it had to be evidence-based medicine. It's a science-based philosophical approach to the practice of medicine that shaped medical care for a generation. However, it's clear from the latest push to mandate masks for children in classroom that health policy bureaucrats have abandoned best evidence in favor of low-level scientific certainty. In addition to promoting and via unconstitutional authority, these overboard, under-scienced masked edicts for society's COVID-susceptible population could cause far worse long-term health outcomes for children. Leaving aside one's politics and position on the unprecedented levels of control exerted by the bureaucratic state, the question remains, is it a good idea to force kids to wear masks in school? We've known since the beginning of the pandemic that kids are the least likely to spread COVID, the least likely to be harmed by COVID, and the most likely to be harmed from COVID restrictions. In fact, the difference in mortality is so pronounced that compared to children, the elderly are 4,333 times more likely to die from COVID and account for 80% of all COVID deaths. Children make up about 1/2 of 1/10 of 1% of COVID deaths, and most of those involve substantial pre-existing illnesses. Furthermore, COVID's impact on the elderly makes government policy deciders laser focus on schools even more puzzling. Zeroing in on children divert efforts to protect the most at-risk groups.
Thank you. Welcome.
Hey.
Hi.
Adam Wagner, I'm a Berrien County resident.
Mr. Wagner, I respect you don't want to give your address on YouTube, but would you give it to Kim before you leave, please?
According to the Open Meetings Act, I don't need to provide that information. I'm a Berrien County resident. Have you guys thought about what developmentally this is doing to children when communication is 80% nonverbal and you can't hear people anyway with the masks on? Have you thought about what it's doing to small children and how they're going to get through the rest of their lives? He spoke about CO2. You're trapping CO2 next to your face by having that on your face. Check your O2 levels after you've worn a mask for a while. Your O2 saturation will go down. My son gets headaches when he wears a mask. Because of that, I suspect. There's no logic to children putting this over their face when they touch it and drop it and trap bacteria right next to their face. You're exhaling toxins when you breathe out and you're trapping it next to your face. It just doesn't make logical sense if you've ever watched a 5-year-old wear a mask. It really doesn't. They touch it constantly, bringing bacteria from their environment next to their face, and they're breathing that in. Luke gave me a thing that says cloth masks have proven to actually cause a higher risk of contraction of SARS-CoV-2 because of, I suspect, all of that. It just, there's no logical sense to this. Have you guys consulted with industrial hygienists in our buildings that are responsible for keeping workplaces healthy? They make sure the air quality is right. They make sure that contaminants in workplaces don't affect their workers. Have you brought those people into our schools to look at that? I mean, there's mitigation that could be done that way as well without causing increased risks of all kinds of stuff to our kids from wearing these masks. So.
Good morning, welcome.
Good morning, Lindsay Eisenhart, resident of Berrien County. First of all, for all the people that are afraid for themselves and their children, if masks work, then wear one. And have your child wear one. That way you will feel protected. I say feel protected because we all know that masks don't really work. You talk about social connections. Kids had a terrible time last year because of masks. I don't know if any of you went to the St. Joe School Board meeting. I was there, and I heard child after child who got up and talked about their physical and the mental impact from wearing a mask. It was terrible. 0 kids have died in our area this whole time. They are more likely to die from drowning, a car accident, or the flu. You would be causing more harm than good by masking them. It's a terrible thing and it's wrong. They have the right to breathe free. And it should be the parent's choice and no one else's.
All right. Jillian, one more? Okay.
Yeah.
Welcome.
Jennifer Mayo Fujawa. I live in Stevensville, Michigan. I'm also not going to provide my address. I don't even know where to begin. Can I ask, at what point in time are we going to be able to ask you questions?
Not during the public comment period. So if you have questions, and what we do is we post the answers on the website.
No, you don't. There has not been a single question answered yet.
I have offered to meet any single one of you in my office.
I don't want to meet in your office. I want this on public record.
Yeah, we want to have a conversation.
Right.
All right.
There's no conversation here when it's you talking to us, and you have your meeting and you have your decisions made before we're even allowed to make comments.
We represent the majority of people.
So I appreciate your comments and I'm here listening to them. This is the public comment period. This is not a response period. Thank you.
But I'm just asking, when is that going to be made available to us?
Okay. On our website, there is a frequently asked question document.
I don't want a frequent, I want a conversation.
We'll keep adding these to it. It's an ongoing thing. So that is there.
Okay. So just if no one heard that, there's a frequently asked questions on the website. We will add questions. So I'm open ears to hear what questions you have and what you'd like to have discussed
I would like to know what the long-term end game for this is, because I think we've all been very, very short-sighted on what's happening. And we're talking about what's happening in the next month or two or so forth. But we're not talking about what's happening in the next year, next 5 years. What's the end game, and how long are you willing to take parents' rights away? And how long are you willing to keep our kids in masks against our consent? What is the long-term plan here? Because I'm not seeing that. I'm seeing very short-sightedness. I've already discussed at the previous meeting that I had a child that has passed out twice on your watch. I do not find that acceptable. I don't think there is any parent who finds that acceptable. This isn't just about what's happening right now. It's about the long-term consequences, the mental health consequences, the psychosomatic diseases that these kids are going to have years into the future on your watch. I want to know that that's being addressed. I want to know that it's being considered. And I want to know that every person in this room is willing to lose their job to do the right thing when that time comes. Thank you.
Welcome.
Hi, my name is Ron Morrison. I live at 209 South Clinton, New Buffalo. What happened to the flu? So that's one question. And then some observations. Number one is there seems to be a lack of transparency. I just searched the meeting the whole day just to find out who you people are. And that's not on your website that I could find. And I'm kind of interested in how you got these positions. So, you know, that would seem civics seems to be missing. And then the word of the day seems to be layers. I want to remind you it's lives. It's not layers. We're talking about lives here. And then two of you mentioned finances. I think a quote was quite a lot of money. And then another individual said, we have money. And I want to remind you, you have taxpayer dollars. Yeah. That's all. Thank you.
All right. Jillian, is there anyone on the live stream who is commenting or who wants to make a public comment?
There are 3 public comments, 2 from Laura Goose saying, thank you, wonderful, thank you so much for your discussion and deliberation. Elizabeth Vogelweed says, thank you for your dedication to this topic and for your difficult decision. That's all.
Those are non-censored.
So the public comment is open. Is there anyone who hasn't spoken who would like to speak? Anyone who would like to speak? We welcome public comment. All right, hearing none, the meeting is adjourned. Thank you for coming. Oh, yeah.